Guns are the leading cause of death for children and teens in the United States. And according to the City of Richmond, gun violence has an even bigger impact on young people in this area. In 2017, the rate of firearm deaths for youth ages 10 to 24 was 3 times the national rate. In 2021, RPD says it took in more than 1,300 reports related to youth victims and crime. But there are a lot of people in our community working to fix this problem. In April, Mayor LeVar Stoney's administration introduced gun violence prevention and intervention framework. Experts from VCU, the Richmond Health Department, educators, and community organizations teamed up with the city to get to the root of gun violence. And the people I spoke with to learn more about this plan are deeply connected and committed to the work.
Right now, our foe, our opposition, is gun violence. It's poverty, it's food insecurity.
Samuel Brown Sr. works as Richmond's community safety coordinator. He was hired in January to connect people with resources and to help the city understand what the community needs.
Hey, how you doing?
Good.
So essentially, we have a lot of agencies that are doing a lot of good work. My primary function is to bring all of us together.
The Gun Violence Prevention and Intervention Framework was created to address and eventually stop the rising gun violence in Richmond. It focuses on high crime areas and youth and uses a holistic approach with a combination of policing, intervention, and prevention strategies to get to the root of the gun violence problem.
Our crime data reflects hotspots in the city. We see a lot of crime connected to poverty. We see a lot of crime connected to where there's a shortage of jobs or there's food insecurity, housing insecurity.
Brown knows the area well. He grew up here in what's considered one of the city's toughest neighborhoods.
As a youth myself, growing up in Essex Village, we had violence. We had opportunities where we maybe attending Calhoun Center and not be able to go outside after we returned home because of the violence that was happening. I actually was their teacher.
Now he's working to make life better for kids who are going through the same circumstances he experienced as a child.
If young people can gravitate to something positive, they're less likely to gravitate to something negative.
One of the advantages I brought to this process is that I actually have close proximity to the communities that we're talking about.
A little ways away from this location, the Peter Paul Development Center, you'll find the home of Tori Edmonds. The community engagement coordinator for the VCU Health Research Institute proudly lives in the house she grew up in.
Yes, it's my family home.
She knows most people view her neighborhood as dangerous, but Edmonds is helping her community turn around.
I'm fascinated with how did we get here?
She studies data and uses it to educate others on what resources her neighbors need to not only survive, but to thrive.
What we hope to do is help people understand what's real. You can't just look at data and say, this is a community. If we didn't walk away with anything else, is that there was nothing in the community for them to do as a family. Where youth violence is the highest, there's no positive opportunities.
Edmonds is part of the team working with the city to stop gun violence.
We call it the Gun Violence Framework, but it's really about human services.
Part of the framework uses money from the American Rescue Plan Act to fund organizations and nonprofits that are servicing high crime areas.
This summer, we were able to fund over 30 grassroots nonprofit in the community.
The city's plan to tackle gun violence is only in the beginning stages, so it will take time to see the real impact. But Edmonds and Brown believe the framework is moving Richmond in the right direction. Do you see the framework, that comprehensive plan, actually making a difference in the long run? Oh,
absolutely. When we see that young people are flocking to these programs or taking our youth gang and gun violence survey, right? And in droves, they're taking it. I mean, our larger number of the demographic that's represented are young people. We're talking 24 and younger that are represented in these, and they're taking these surveys and they're telling us what they think. They're being very candid, they're being very honest, and quite frankly, they're our experts. They're gonna help us to understand how we get through this.
The biggest challenge that we have in the city is the narratives that we give about our young people. The community have been labeled as traumatized. You remember they say words are
powerful, yeah.
Powerful. And so if I'm telling you this is who you are, then you begin to embrace it.
So we need to change the narrative.
We need to change the narrative.